Sarah, I wanted to ask you about a group of women who comment all the time on our podcasts, and they are that group of women probably in their 60s and 70s, and they're that generation who absolutely unfortunately missed out on HRT. This group of women who are, intelligent and they're hearing everyone talking about HRT and they're feeling like they've horribly missed out. So, what is your take on when is too old to start? How do you approach it as someone who comes and they're 63 or they're 83 or
I think that there is some new literature that's showing that the benefits outweigh the risks. So, getting started, like if you're were to prevent UTIs and bone fractures and, in this population, that's great. Like they should be offered it. You've gone a long time without hormones, your arteries can come stiff. And then you introduce the hormone and they could become pliable and you could like, what if there's some plaque there that I think that's like what everybody's kind of worried about. And to mitigate this risk for that age group, a cream is probably like a really good choice because you're using creams instead of like an oral estrogen or something like that. Also, just like making sure that they start a little bit lower and then they understand that there could be bleeding risks and things. But I have a cutoff online just because it's so hard to treat, online already. And so since I'm telemedicine only, don't take older women, but it's not because I'm ageist or I don't think that they deserve it. I just think it's better that they would get it from a clinician who can maybe tailor and do this very probably more tailored approach for this population. Like we need to do just a tiny bit of this and a little bit more of this, and this is fine for them. I think that's actually very appropriate, and using clinical judgment and then having a discussion with the patient is really important.